again come in on budget, indeed £28,000 in the black. However, I think that it wouldn't be fair or right to the residents of Thurrock not to absolutely emphasise the reductions that have happened and that are continuing to happen under the Tory government. I'd like first of all to tell people my budget in health and adult social care has been reduced from 40 million down to 30 million. That's 3/4 of the budget, and still the officers are working extremely hard to ensure that we've got excellent services out there. It's becoming ever more difficult. In Thurrock, we've agreed across party that one of our top 5 priorities is to improve health and well-being among our local people. It's therefore with dismay, I have to say, that in my share of the report that the leaders just put forward, my portfolio of health and adult social care has a further £500,000 cut in year. That's this year. The money that's already been allocated, contracts have already been signed, services are already being delivered, and now I have to find another £500,000 in year. That's £830,000 in a full year. And those cuts are once again making me feel very dismayed. They include the removal of 5 social worker jobs, so we're now down to the minimum that's allowed. Another review of our changes like blue badges and respite care and others are just as unpalatable, but they come in within that 500,000. I cannot emphasise strongly enough that there are consequences to the ever-decreasing pot of money available to us, even though our officers and our frontline staff have managed to keep excellent services so far. Our residents, and especially those who receive adult social care services, will be badly hit by these cuts and negatively affected. Then last week, it seems to have gone under the radar nationally, but the Chancellor's comments in the Queen's speech debate promises even more cuts for local councils and the public sector in general, but it didn't provide any details. However, in my area, public health, we have a fair idea what's coming. The Chancellor announced a 7.14% reduction, again in public health spending. Nobody knew it was coming, nobody's ready for it, and nobody knows how it's going to hit exactly. It's important to realise that public health spending in councils is ring-fenced, which means the government tells us how much we're getting, and we have to design our services around that, which indeed is what we've done this year. When public health was devolved and came into this authority, some of you will remember from the PCT, we had to fight to get our full entitlement, as 1.2 million of it was given to Essex. We had Duncan Selby down, the head of public health, to put our case forward, and the leader and the past chief executive wrote to ministers to make sure that we got that money back. Now the government's proposing to take half again on top of that, 7.4%, that's £600,000 out of our budget. Where do we make the cuts? How deep are they going to be? What services do you want us to close? If we take 7.4% off everything we've planned to run this year, we're going to have where do we take it off? Do we take it off one service? Do we take it off school nursing? Do we take it off sexual health, smoking cessation? It has to come off a service. Our officers now are very lean. We've looked at all of our structure and gone down as far as we can. Our frontline staff are very lean, as I've explained, with only another 5 social workers reduction. So, you know, I wanted to say that tonight, Leader. It sounds very negative, but we've got very positive budget reports, but I can't emphasise enough. It's not easy, and now we're really cutting into what the residents are receiving. And we need to understand that it's the Tory government cuts that are affecting our residents in this negative way. And as the Leader says, on the 8th of July, let's hope there's not any more surprises around the corner for us. Thank you for indulging me, Leader.
Barbara, thank you.